Hello everyone. Today we'll see the female maternal pelvis. So anatomy of this pelvis is the maternal pelvis is made up of 4 bones, 2 innominate bone on each side and one sacrum, and with the one sacrum and posteriorly coccyx is there. Each innominate bone composed of 3 bones: ilium, ischium and symphysis pubis. And the symphysis pubis join anteriorly. 2 sacroiliac join posteriorly, and along with the sacrococcygeal joint is posteriorly there. The symphysis pubis is secondary fibrocartilaginous joint without a capsule or a synovial cavity. Then the cartilage, the articular surface of these two pubic bone, these articular surfaces, these two pubic bones, symphysis pubis, two pubic bone are covered with a hyaline cartilage. On the other hand, the sacroiliac joint between the ilium and is sacrum. The sacroiliac joint is between the ilium and the sacrum is the sacroiliac joint, and there is a synovial sacroiliac joint, and sacrum is a synovial joint. This is a sacrum is a synovial joint with a capsule and a synovial cavity. Then due to the softening of the ligament during the pregnancy, probably under the effect of the hormone of relaxin, some gliding movement is there. Are possible at the symphysis pubis and the sacrococcygeal iliac joint due to the relaxin hormone, and due to the softening of the ligaments will be soft during the pregnancy. So due to the softening of the ligaments during the pregnancy, hormonal relaxin, under the effect of the hormone relaxin, this sacroiliac joint and the symphysis pubis joint there will be a gliding movement is there, and these joints will be relaxed, thus causing the enlargement of the pelvis cavity during the labor, because this ligaments is soft, and because of that this pelvic cavity will be enlarged. Even the coccyx push, this coccyx bone is there, you see here, even the coccyx pushed back at the sacrococcygeal joint by the descending of the fetus head. When the fetus head is pressed, the coccyx when the fetal head is pushed, the sacrococcyx bone, that the sacrococcygeal joint is going back by the descending of the head. And in the upper part of the pelvic divided into two parts: false pelvis and a true pelvis. False pelvis is the upper part of the pelvic bone, and true pelvis is the lower part of the bone. Then we will see one by one. This is the ilium. So ilium is a large flare out part. When hand is placed on hip, it is rest on the iliac crest, which is the upper border of the ilium. At the front of the iliac crest can be felt a bony prominence. You see here the bony prominence known as the anterosuperior iliac spine. At the short distance below is the anterior inferior iliac spine. Here it is the anterior inferior iliac spine. Then there are two similar points, one point here and one point here. There is two similar points at the other end of the iliac crest, namely the posterior superior iliac spine and posterior inferior iliac spine. Yes, the concave anterior surface is known as the iliac fossa. Then comes the ischium. Ilium is over, then comes the ischium. The ischium is the thick lower part. It has a large bony prominent known as the ischial tuberosity. It has a large bony prominent. You see here bony prominent. This is a ischial tuberosity. In inward projection known as the ischial spine. Then comes the pubic bone. This is the pubic bone. This pubic bone form an anterior part. It has a body and two anterior part is there. It has body and two oral-like projection. This is a two oral-like projection. At the two oral-like projection, it is a superior ramus and an inferior ramus. This is a superior ramus and the inferior ramus. The two pubic bone meet, this pubic bone, this two pubic bone meet at the symphysis pubis and inferior rami. Inside is the inferior rami from the pubic arch. Inferior rami from the pubic arch. The space enclosed by the body. This is the space. This space enclosed by the body of the pubic bone. The rami, this is the rami, and the ischium is called the obturator foramen. The innominate bone, this is the innominate bone, a deep cup is received. Here it is a deep cup. The innominate bone, it contain a deep cup to receive the head of the femur of the acetabulum. The one of the lower border of the innominate bone are found two curve. Here it is a two curve. Here it is and here it is two curve. Is called the greater sciatic notch. From here it is a sciatic notch is passed. It is a wide and round. The other lies between the ischial spine. Inside the ischial spine is there and the ischial tuberosity is known as the lesser sciatic notch is there. Then comes the sacrum. Sacrum is a wedge shape just like a snake's face. So sacrum is a wedge shape bone consists of a 5 fused vertebrae. You see here 1, 2, 3, 4, 5 fused vertebrae. The upper border of the upper border of the sacrum vertebra is just forward and known as the sacral promontory. Then comes the anterior surface of the sacrum. It is a concave and referred to a hollow of the sacrum. Then laterally, both sides laterally, sacrum extend into the wing of the ala. They both side the wing of the ala. 4 holes is there. 4 holes in the sacrum. 1, 2, 3, 4. There is a nerves in rough end to receive the attachment of the muscles. Then comes the coccyx. You see the coccyx here, it is little bone. Coccyx is a vestigial tails and it consists of 4 fused vertebrae. You see 1, 2, 3, 4. 4 vertebra forming a small triangular bone. Then one sacrococcygeal joint from the here. This is when here will be the joint. One sacrococcygeal joint. Then symphysis pubis joint and the sacroiliac joint. Symphysis pubis is formed at the junction of the two pubic bone and which are united by a pad of a cartilage. The sacrococcygeal joint, these are the strongest joint in the body. Both sides they join the sacrum to the ilium. Thus sacrum to the ilium, thus connected the spine to the pelvis. Then sacrococcygeal joint, this joint is formed where the base of the coccyx articulate the tip of the sacrum. Okay, if you like this video, like it and support it. Then next video we will meet the ligaments of the pelvis. Okay, bye bye.